of life's most perplexing questions.
In just 2 minutes, you get a look at the fascinating world around us and beyond.
We hope you'll tune in.
For more information about A Moment of Science or to download our latest podcasts, visit us at amomentofscience.org.
Listen weekday afternoons at 5:45 on KSJE. KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them. Whether it's a stroke, heart attack, illness, or injury, San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Twelve minutes past 8 o'clock. It is Wednesday morning, December the 9th. Good morning, everybody. I'm Scott Michlin. Thank you for tuning in to KSJE 90.9 FM over the air here in San Juan County, 103.3 FM over the air in Durango, Colorado, and streaming everywhere from our website, KSJE.com. Welcome also to our viewers who are watching our visual radio program. The video is streaming live to the KSJE social media platform, so we're glad that you are with us, however you have joined us this morning. Coming up in the next few moments, we're going to be talking about family medicine here in the community. A brand new family medicine clinic is set to open next month. We'll be talking to two folks who are part of that happening coming up in the next few moments right here on KSJE, so please stay tuned for that. Later on this hour, we always check in with Dr. Mike Hadabaugh on Wednesdays from the Encouragement Lab. This week, of course, is no different. This week, Dr. Hadabaugh is going to be explaining to us why, the surprising reason why some people may be angry at you and me and everybody. We'll find out what that's all about coming up at 8:50 a.m. on KSJE this morning, so stay tuned for that. Next hour at 9 a.m., Mick Hess takes us roving with the arts. It is our weekday classical music program, and this Wednesday, of course, is part of Mick's special series called Local Favorites, when he catches up with a local musician, or in this case, a former local musician. Edie Farm is going to be talking to Mick Hess on the show today, and we're looking forward to hearing what Edie has been up to and some of her favorite pieces of music. That is coming up today at 9:06 on KSJE, a special 90-minute version of the program, and that will take us to 10:30. And right on Four Corners, Tracy Hales-Vass is speaking with author Linda Hogan today about her latest book, which is called A History of Kindness. You'll hear more about that coming up today at 10:30 on KSJE, so we hope that you will stay tuned for that. No reason to turn away this morning. Don't forget, of course, in addition to Facebook, YouTube, and Twitter, you can also connect with us on Instagram as well. And let's check in on the weather forecast today. It's going to be mostly sunny, our last kind of mild day for a while. Today's high 51 in Farmington, with lots of sunshine, 20 overnight tonight. But then another weather system moving in with a chance of rain or snow showers for the next 3 days and colder temperatures. 41 for a high on Thursday and Friday was the chance of snow showers in the forecast. 26 overnight on Thursday, colder on Friday, down to 18. 38 with a chance of snow showers on Saturday, and the overnight low of 10 degrees. And then sunshine returns on Sunday, but so do the cold temperatures with a high of 36 degrees. So let me turn to my guests who are here with me this morning, as I mentioned, to talk about family medicine and this brand new clinic that is about to open here in the community. And from San Juan Regional Health Partners, let me bring on our guests this morning. Shaleen Brown is here. Good morning, and thank you for joining us this morning. It's great to have you on the program.
Oh, I'm Melissa Gladden.
I'm sorry, Melissa. Nice to have you on the program.
Thank you for having us, Scott. Thank you.
You bet. Thank you very much. And then Dr. Sienna is also joining us as well, correct, Doctor? Thank you for coming in.
Yes. Hi, good morning.
Thank you. And so talk to me a little bit about this new family medicine clinic that you both are a part of, correct? Talk to me a little bit about how that got put together.
Yeah, first off, we're so excited to get started next month. The reason for this new clinic opening up is to sort of capture those patients who don't have a primary care provider, which there's about 30 to 40% of patients who get discharged from the ER and from the hospital who don't have a regular doctor. So this clinic, like I said, will help capture those patients and establish care with them.
Very good. And of course, we know in our community there has been, I think, a shortage of providers that are in our community that are accepting new patients and things like that. At least there have been in the past. Maybe that has changed recently, but I would assume this is going to fill a big need in the community, won't it?
Absolutely. Yes.
Yeah, I think part of the importance is, as Dr. Sienna said, many people don't have a primary care doctor, and so that increases the visits to the ED. And so we're hoping that by providing regular care for people, that will lessen the visits. And if they've got, their regular screenings, so, we just want people to know it's really important to do regular screenings and, for their wellness, to keep them out of the emergency room. And so we're hoping that by capturing these people that we'll be able to, do more preventative care and keep them out of the emergency room.
Right. Good point. And of course, putting all this together in a time of COVID-19 has got to be a little additional challenge as well, right? To set up practices and safe practices to be able to let folks either come in face-to-face in some cases or connect telephonically or video link or whatever the case may be these days, right? There's a lot of technology at work.
Yeah, pretty much. With whatever devices we have, we do televisits, video visits, and even at the new clinic, I think we're going to be seeing COVID and PUI patients as well.
Right.
Which brings up another interesting point, is that this particular clinic has a negative pressure room with its own entry and exit on the side of the facility. So we're excited to start using that as well.
And doctor, I think I know what that means, negative pressure, but maybe some of our audiences don't. So obviously that's the air pressure, and that helps because why? How does that help keep people safe?
Maybe Melissa can help explain that.
Okay.
So basically, the ventilation is not connected to the rest of the ventilation in the clinic. That way we can keep that separate. So if, COVID, were to be airborne or any type of airborne disease, we keep them out of the clinic, at the regular clinic, and then they can come in off on the side and not even come through the regular clinic through the front.
Got you. Makes sense. Perfect. Well, interesting. And so will there be other folks working with both of you at this new clinic? How big a staff will you have?
Connection a little bit.
Oh, so I can hear you.
We can still hear you, doctor.
Yeah, and I can answer that question. So the plan is initially there's going to be Dr. Sienna, myself, and as well as Anna Buck, and we're both nurse practitioners, and then we have Dr. Sienna. So there will be three of us, three providers running the clinic.
Gotcha. Very good. And this is set to open next month, as I mentioned. Is that still on track?
We're still on track for January 4th. Yeah.
Very good. And where's the clinic going to be located? Can you give us the details about that?
It is across the street from the hospital, so very, very close to the emergency room.
Gotcha. Very good. Doctor, are you able to still hear us okay, or is our connection
I can
failing?
hear you. I think it's just Melissa's connection.
Gotcha. Technology. We love it. Live radio. We love that too.
Gotta get used to it.
But that's all right. Appreciate you both being with me this morning. Doctor, talk to us a little bit about your background too, if you wouldn't mind. Are you relatively new to the community?
I am. I just drove here from Miami, Florida. That's where I did my residency training. Before then, I attended medical school actually here in Arizona, and then as part of that program was able to go out to a community health center in Hawaii. So I was kind of spoiled in a sense, getting to enjoy the beaches out in Hawaii for 3 years. Didn't distract me too much from studying. I was able to
Evidently not.
make it to residency one time. But on top of that, I went to Miami, Florida. During my last year, obviously, ran into what's going on now with the pandemic, and it's been crazy. It's still crazy over there. But I think what I like a lot about this clinic here, all 3 clinics, as a matter of fact, is that everyone's very on top of the guidelines and protocols for the virus.
Well, that's good to know. And well, again, welcome to the community, and we're glad to have you here. And I know it's not quite the same as Hawaii, but it's.
I like the change in weather.
Well, good.
I got tired of the humidity after a while.
Well, good. We'll stick around for a few more hours because it's going to change again. So I think that's great. But welcome. It's great to have you here. And Melissa, let me turn back to you a little bit about some of your work, and of course, dealing with all types of patients, right, at a family medicine clinic, right? You are prepared to deal with all members of the family, correct?
Yeah, for family practice, we do see all members of the family. And then a little bit about my background. I'm actually a native to the community, so I'm here to stay. And I went to University of New Mexico, so.
Very good. And I know, that's always a big deal for recruitment and things, to try to get folks who are from the community to come back to the community or stay in the community and start a clinic or see patients from the community. I know folks really appreciate that. And was that important to you to be able to stay kind of close to home or in an area that you're familiar with?
Yeah, absolutely. I mean, this has been my community. Like I said, that I grew up here. So it was important for me to return to the community and be able to serve the community here. And so, I know the needs of it. I know we're much needed to have more providers here. So I'm glad that Dr. Sienna has come, accepted to come here as well. And, we're excited to serve our community.
Very good. And again, you are going to open this clinic in January, as you mentioned. And so can folks start making appointments or kind of checking it out and seeing what's available or getting on your list?
So I believe as January 4th is when we'll start accepting appointments.
At that time?
Mm-hmm.
Got you. Very good. And so talk to me a little bit about some of the other things that you'll be able to do there. I mean, mostly checkups and things like that, or if folks have other aches and pains, can they come and talk to you? It's going to be a full service family medicine clinic, correct?
Yes, it is. We'll be able to see, like Melissa mentioned, the family, and at some point do regular follow-ups, and like we had mentioned earlier, even seeing the COVID patients who have just been discharged, and persons suspected of having COVID as well.
Very good. And I know, again, this year has been so different in regards to COVID and what the whole world is dealing with. And so you'll be able to deal with some of these patients who are coming in and determining if they're able to go home and treat themselves maybe at home, depending on how severe a case of COVID it is, or if further treatment is necessary, right? That's all part of the process, right?
Right.
Yeah, and in addition, San Juan Regional also has a COVID to home clinic where they manage people, those that don't qualify to necessarily stay in the hospital to be admitted. They have a close monitoring program, and they're able to give them an oximeter, which is something that can go on their finger to check their oxygen levels, and so they follow them really closely as well.
Which is great, and I know we've talked a lot about that on the program with some of the COVID to home folks who are working with that program, and of course our thoughts are not to overwhelm our hospital, and to be able to do some of this from home has got to be a great relief from putting extra patients on the floor at the hospital, if we can avoid that, if they can be get better at home. And so, again, to both of you, I guess the question would be, in all your medical training, obviously, I'm sure there's talk about pandemics and things like that, but here we are in the middle of one. Did you ever think you'd be practicing medicine in the middle of a global pandemic? Doctor?
Absolutely not.
But, that's the short answer.
It's funny because when I went to Florida, I wasn't used to the hurricanes, and so we'd always have protocols each year around September, October to to have teams come in and watch the hospital while everybody shelters in place and whatnot. And I thought that was a big change for me. And then the pandemic started towards the last few months of training. That just added another layer of, I guess you can say, it was just very interesting. It was very scary to kind of go off of your point about patients. The COVID to Home program, it is pretty important to have this program because the hospital is getting, the beds at the hospital are getting pretty full and having to discharge patients early. So to have this program in place will help those patients get the needed equipment like oxygen and the pulse oximeter that Melissa mentioned.
Right.
Things like that.
Very true.
And we'll be able to monitor them daily. Good
point. And Melissa Gladden, I want to ask you this kind of the same question about practicing during a pandemic. It's got to be a little bit different from what you went to school for.
Yeah, no, absolutely. I never, like Dr. Sienna said, I never really kind of crossed my mind, and we didn't particularly talk about pandemics during my training, so not anything that planned or anticipated, but it's definitely changed the way we do our normal day-to-day practices and having to, all the extra cleaning and all of the extra measures that we take to protect ourselves and our patients. So it definitely takes more time, but more important, to make sure we keep everybody safe as well as our staff too.
Very true. Well, and that is what we're all concerned about as well. And we know how many long hours and how hard folks are working there throughout the hospital system to keep everybody safe and to deal with the patients that are coming in. And not to make this a program about COVID, but again, from what you're both are talking about, we know, at least from what we know, it seems like the infection, the virus, can impact different people differently. And some people are get very sick and have to go to the hospital. Others, as we've mentioned, can maybe use this COVID to Home program and recuperate at home under a doctor's supervision or nurse practitioner supervision and things like that. So it's just a lot of unknowns, and we don't know how it impacts each individual person. But let me get back and ask you about the clinic. And so for folks who are maybe looking for a new place to go for healthcare in the community, again, your clinic will be open in January, as we mentioned, and offering all things for young and old, correct? For a full family.
Yes.
Yes.
Very good. And is there anything that you are seeing besides COVID, of course, that folks are coming in with or hearing about as you start to talk about seeing patients that folks are coming in? Obviously, it's cold and flu season, and that may be a little diminished with some of the precautions we're taking because of the pandemic.
Yeah, no, it'd be. And one thing that I wanted to mention, Scott, is that I think it's important that people know that, we are still here to serve patients, and we are taking extra precautions when people do have to come in for an in-clinic visit, to both keep ourselves safe and them safe. And so I think it's important for people to still get their regular health care, because what I found is that a lot of people and then we also offer video visits as well. So even if people, are afraid to come out, which is completely understandable, it's still important to be checking in, because I've had many patients who have ran out of medications and and just didn't want to come into the clinic. And so that, has long-term impact on their health, but also, keeping healthy is the best way. If you were to get COVID, it's important to make sure you're staying as healthy as possible. So make sure you're getting your regular treatments and, knowing that there are other options to provide health care so that people can get, their routine medications and not have those lapse.
Right. That's a great point. And we've heard that a lot about folks maybe postponing some checkups and things like that. And that's probably not a good idea. So I hear you loud and clear. Doctor, again, I imagine you deal with the same type of thing of folks maybe that aren't keeping up with their normal appointments and maybe thinking, they can hold out until COVID has maybe gotten a little bit more under control. And that's probably not a smart thing to do, right, for any member of the family.
Yeah, it's tough. People are very concerned. But like Melissa said, it's very important to keep on top of your medical care, especially when we're talking about certain conditions like diabetes, high blood pressure, COPD, history of heart attack, stroke. These are patients that are very susceptible to getting the virus, and furthermore, going downhill pretty quick.
those are some of those underlying conditions that we hear about when we talk about
Right.
these COVID patients, right? That it may make things a lot more serious in those individuals than others, perhaps. Correct?
Yeah, and if I can share a quick story.
Yes, please.
I had a colleague of mine in residency. He was my senior, and his father had diabetes, high blood pressure, and other than that was not being managed for anything else. He was fairly healthy. He ended up contracting the virus. It went downhill pretty quick, and within about 4 or 5 days, he unfortunately passed away. And then that was, as you can imagine, very upsetting for the family, for my friend, and that just makes it so much more important to stay on top of, your healthcare.
Very true. Well, and we know that this is impacting hundreds of thousands of people in this country and millions across the world, obviously, with the number of fatalities that we are seeing. And each of these stories, each of these numbers has a story behind it, like you've just shared with us, Doctor. So I do appreciate that, and that is why we are taking the precautions that we are taking every day in our lives to protect ourselves and each other. I would think that both of you would certainly agree with following some of the public health guidelines that have been issued, and as we learn more about this, to stay safe as the vaccine gets rolled out. That's certainly good news and encouraging news, but even that's going to take several months at least to get to our neck of the woods, I would think, and to everyone who needs it.
Yeah, no, absolutely. I think it's still important. We still have to follow, like you said, guidelines and making sure that we're still limiting, social distancing and wearing a mask and only doing essential, activities. And that way we give the chance, because we still have a long ways before everybody's going to be able to get the vaccine. So, because initially I know we're got some promising news here, hopefully within the month, that we may be able to start vaccinating, but that will be probably frontline health workers initially. So it's going to take some time. So if we can just continue to do our social distancing and wearing masks and, good hand washing and trying to stay healthy.
Exactly. And Dr. Sienna, I imagine, again, for you, same type of thing, right? As the new recommendations come out, it's important that we try to follow them because it's such an infectious virus, correct?
Absolutely. And one of the creative ways some of the patients I've spoken to are trying to get around grocery shopping and whatnot is they'll have their loved ones who may not be as susceptible to getting the virus, the younger, healthier population, go out and to the grocery stores and get them food and whatnot. Of course, we want those people to continue to wear masks and social distance when they do that. But what I'm finding is a lot of the stores in this area have followed the protocol very well, so it's not as scary, like I said, for those folks to go out and get the necessity things, the necessary things. Sorry, I'm getting tongue twisted.
That's all right.
That they need.
Sure. No, very true. And of course, since every state is kind of doing their own thing, from coming from Florida to New Mexico, very different in how the states have responded to this pandemic, at least as far as maybe the governors are concerned. But let me go back to the clinic in our remaining moments together this morning. And again, if you both could just remind us that the clinic will start seeing patients and be open for appointments beginning in early January, and remind us again of that date.
Yep, so we will start, January 4th is when we're projected to open, and we're really excited about that. We'll be able to provide care to all spectrums of ages, and we're hoping to capture, like we said, the urgent care, emergency room department visits, those that don't have a primary care, but we are also going to be doing regular care for anybody that needs a primary care provider.
Very good. And folks can find your information for the clinic. Is it on the San Juan Health Partners website, or what's the best way for folks to get in touch with you to make that appointment or to come see you? Melissa, do you know?
You know what? I had it on my phone. I was trying to find it.
Okay, so I put you on the spot. That's all right. We'll let you look it up, Doctor.
That information will, I'm sorry. that information will come within the next few weeks.
Okay.
I think we're excited to tour the clinic in a few weeks. We're actually next Friday, not this Friday, but next Friday with Shaleen Brown, who will be the clinic manager.
Great.
She'll provide those details and about how to get the word out there.
It really is new, is what you're telling me.
Yes.
It's so new. You're going to go on a tour, not next week. You haven't seen it yet.
Yeah, hopefully we get to
yeah,
go inside and not just loiter around the property. But
yeah, we haven't even been inside yet.
Very good.
yeah,
Well,
they've been working hard to get that set up, that clinic set up.
excellent. Well, that's great. Well, again, I hope that it goes very well and with both of you. And I appreciate you both joining me this morning to talk a little bit about this, again, new addition to the community. This is a brand new clinic, as we've mentioned, a new place for folks to go for family medical care. And we always talk about the need for more providers, and here is one way that the need is being met. So thank you both for being my guests this morning. I appreciate it very, very much.
Thank you.
Thank you for having us.
You're very welcome. Thank you both very much. As I mentioned, my guests this morning, Dr. Quincy Sa'Ena and Melissa Gladden here from San Juan Health Partners, my guests on KSJE. Back with more in just a moment, everybody.
The COVID vaccine has arrived, and it's nothing short of a technology miracle. From American Public Media, this is Marketplace Tech. I'm Molly Wood.
Marketplace Tech is supported by Rubrik, a company offering simplified data management with instant data recovery and ransomware protection. Because when your data is available for everything, you can be ready for anything. More at Rubrik.com.